Welcome to the deep dive. Today, we're tackling something that sounds kind of simple on the surface, coccidiosis.
Mhm.
But as we dug into the research, the veterinary articles, wow, it's this whole hidden world. A parasite playing biological hide and seek, huge economic ripples, and this constant race to stay ahead. So our mission today, unpack it, get into the weeds, understand the real risks, the science, the strategies.
Yeah, and it's fascinating because, even if you listening aren't a vet or a farmer, the themes here, they resonate. Disease transmission, how we prevent things, that whole host-parasite dance.
Yeah.
It tells us a lot about biology, about managing complex problems generally.
That's a great point. It makes you wonder what else we overlook. Okay, so we're going to cut through the noise,
Yeah.
give you the clear picture, maybe some surprising details along the way. Let's unpack this.
Yeah.
Right, first things first, for someone maybe hearing this term for the first time, what is coccidiosis? Lay the groundwork for us.
Okay, sure. So fundamentally, coccidiosis is a parasitic disease. It's caused by these tiny single-celled organisms, protozoa, mostly from the genus Eimeria or Cystoisospora, their main target, the intestines. Though sometimes other organs, and when get established, you see things like diarrhea, weight loss, animals just not growing well. In bad cases, it can unfortunately be fatal. And it's everywhere. Livestock, poultry, dogs, cats, even wildlife.
Okay, so gut issue, basically. But you mentioned something really key earlier, this difference between just having the parasite and actually being sick. Can you dig into that? Because that feels important.
Oh, absolutely vital. It's a huge distinction for anyone trying to understand this properly.
Yeah.
You might do a fecal test on an animal, say an adult cow, find some Coccidiosis. Those are like the parasite eggs. But if the animal looks perfectly healthy, often that finding is considered insignificant, no big deal. However, and this is the tricky part, especially in like big flocks of chickens or herds of calves, you can have these subclinical infections. No obvious sickness, but the whole group suffers. We're talking slower growth, using feed less efficiently, huge economic losses, even without diarrhea everywhere, which, leads to that big question, how do we even spot that? When do we step in if the signs aren't obvious?
Yeah, that's a real challenge. Are we talking constant testing or specific subtle signs? Because like you said, one animal seeming fine doesn't mean much when you look at the whole operation. And this is where that economic impact really hits home, isn't it? You hear animal tummy ache, but you're saying this little parasite costs billions.
Billions, globally. Yeah. The poultry industry alone loses, estimates say, over $2 billion a year. That's from deaths, sure, but also just poor weight gain, bad feed conversion.
Wow.
And in cattle, those subclinical infections, they can stunt an animal's growth permanently, a poor doer for life.
And beyond the money, the animal welfare side.
Mm-hmm.
It sounds pretty grim.
It really is. Clinical coccidiosis means real suffering. Abdominal pain, dehydration, distress, straining to defecate, that's called tenesmus. Plus, the damaged gut lining makes them vulnerable to other nasty bacterial infections. It just piles on.
Okay, so to really get this, we need to know the culprits, the parasites themselves. You mentioned Eimeria and Cystoisospora.
Right, those are the two main players. And what's really neat biologically speaking is how host-specific they are. Eimeria species, they're the big problem in production. Animals, chickens, cattle, sheep, rabbits, older pigs. And there are tons of Eimeria species, but each one usually sticks to just one host type. A chicken one won't bother a cow one won't bother a sheep.
Okay, so they're specialists. What about the other one, Cystoisospora?
Cystoisospora. Yep. Those are more common in companion animals, dogs and cats. They're also the cause of that specific type of coccidiosis in very young piglets, the neonatal form.
Got it. That specificity is interesting.
Yeah.
But the life cycle,
Mm-hmm.
you said, is pretty devastating. How does that actually work? How do they go from being shed to causing all this trouble?
Okay, so it's a direct life cycle. Everything happens in one host, no intermediate needed. Two main phases, exogenous, outside the host, and endogenous, inside. It starts with these non-infective oocysts shed in the animal's poop. But here's the thing, they're harmless at first. They need time outside, maybe a day or two, with the right conditions, warmth, moisture, oxygen to sporulate, basically to activate and become infectious. And their survival skill, amazing. That thick wall protects them. They can sit in the soil or litter for up to a year, just waiting.
A year. Wow.
Yeah.
That's persistent. So an animal eats one of these sporulated infectious oocysts.
Yeah.
Then what? Where does the damage actually happen?
Right, so once ingested, they release forms called sporozoids inside the intestine. These invade the cells lining the gut. And here's the kind of aha moment, the real damage phase, morogony, asexual reproduction. They basically turn into little factories inside the cells called schizons, multiplying like crazy. Then the cell bursts, releasing thousands of new forms, merozoids that go infect more cells. Boom, boom, boom. Widespread destruction. And here's the crucial timing bit we touched on, this massive damage. It happens before the animal usually starts shedding lots of new leukocysts, and often even before you see obvious signs like diarrhea. It's called the pre-patent period.
So the worst is happening silently, before you even know there's a problem.
Exactly. By the time you see the diarrhea, a lot of the damage is already done. That's why prevention is so critical. You're playing catch up otherwise. After those asexual multiplication rounds, they switch gears to sexual reproduction gametogamy. Male and female forms combine, make new oocysts. Those get shed in the feces, and the cycle starts all over again.
That timing is just wow. It explains so much about why it's hard to manage. It really does sound like a numbers game then. Like how sick an animal gets depends on how many parasites versus how strong the animal is.
You nailed it. It's absolutely a numbers game. Host factors matter hugely. Young animals, almost always the most susceptible. Their immune systems just aren't fully developed yet. And stress. Stress is a massive trigger. Weaning, shipping, overcrowding, sudden feed changes, bad sanitation, all that stuff can weaken immunity and let the parasite take hold, leading to an outbreak.
Okay, so young age and stress on the host side. What about the parasite itself? Does like the amount ingested matter or the specific type?
Definitely. The sheer number of sporulated oocysts eaten the infective dose is directly related to how sick the animal gets. A huge load can overwhelm anyone. Plus, some Eimeria or Cystoisospora species are just naturally more pathogenic, more aggressive than others. But there is a positive side to this, which is immunity.
Ah, right. The animal can fight back, build a defense.
Yes, exactly. The infection runs its course, it's self-limiting, and animals that recover develop really strong, long-lasting immunity. It's species-specific immunity, mainly driven by T cells. So often the goal in control isn't zero exposure, but rather like a controlled low-level exposure, enough to trigger that immunity without causing actual disease. It's a balancing act.
Okay, that makes sense. Manage exposure, build immunity.
Yeah.
So let's take this out into the barnyard, so to speak. How does this actually look in different animals? You mentioned poultry is huge economically. What's unique there?
Poultry is fascinating because of the extreme site specificity. Different Eimeria species infect very specific parts of the chicken gut, and they cause really distinct pathognomonic lesions, like a signature injury pattern. For instance, Eimeria tenella only hits the ceca. Those are blind pouches off the intestine, causes intense bleeding, characteristic sickle cores made of clotted blood. Eimeria necatrix goes for the middle part of the small intestine, gives it this salt and pepper look on the surface. Eimeria acervulina prefers the upper small intestine, creates these whitish, ladder, rum-like streaks. You can almost diagnose the species just by seeing the damage location and type.
Wow, that's specific. Like forensic pathology for chickens. What about bigger animals? Calves,
Yeah.
piglets. You mentioned piglets earlier.
Right. In young ruminants, calves, lambs, goat kids, coccidiosis is a major cause of diarrhea, poor growth. Those poor doers we talked about. Some species, like Eimeria ovoidalis in sheep, can cause really severe bloody diarrhea. For pigs, that neonatal coccidiosis from Isospora suis is key. It hits piglets, like 5 to 15 days old. The diarrhea is distinctive, not bloody, but pasty, watery, yellowy white, really foul smelling, and a big clue for vets. It doesn't respond to the usual antibiotics you'd try for bacterial diarrhea. That points you towards coccidiosis.
Okay, that non-response is a critical diagnostic hint. What about, less common farm animals or pets?
Rabbits are interesting. They get two main forms. There's hepatic coccidiosis from Eimeria staidae. That one infects the liver's bile ducts. Animals lose weight, get stunted, pot-bellied, and you see these yellowish white spots, nodules all over the liver. It's quite dramatic. Then they also get intestinal coccidiosis from other Eimeria species, causing the usual diarrhea.
Liver and intestine.
Camelids, llamas, Alpacas, Eimeria macuseniensis is the big one. It has unusually large oocysts, and it's highly pathogenic. Causes severe bleeding in the gut, especially in young ones, crias. But sometimes the outward signs can be minimal until it's very advanced.
Tricky. And our dogs and cats?
Dogs and cats, it's usually Cystoisospora species. Most adult pets might carry it without any signs at all. Clinical disease is mostly seen in puppies and kittens, or in adults whose immune systems are compromised for some other reason. Shows up as watery diarrhea, sometimes with blood.
Okay, so it really varies across the board, which means diagnosing it probably isn't always straightforward. How do vets figure it out definitively?
You're right, it takes detective work. It's multifactorial. You need the clinical history, the physical exam findings, and lab tests. Because remember that timing issue? How bad the animal looks doesn't always match how many oocysts they're shedding right then.
Right. So lab tests, what's the go-to? Fecal samples.
Exactly. Fecal examination is the cornerstone. Standard procedure is fecal flotation. That tells you qualitatively, yes or no, are oocysts present. Then you can do quantitative tests, OPGs, oocysts per gram of feces. That gives you a count, an estimate of the infection level.
Okay, so you get a count. But what if an animal dies? Or you're dealing with a whole flock outbreak?
In those situations, post-mortem examination, a necropsy, is incredibly valuable, especially because of that pre-patent period problem. Seeing the actual gross lesions inside the intestine, those specific patterns we talked about, particularly in poultry, can be the key diagnostic finding, sometimes even before oocyst shedding peaks. So interpreting the results, that's where the nuance comes in. That's the important question, right? How do we put it all together?
Yeah.
High OPG counts plus clinical signs, pretty strong evidence for coccidiosis causing the problem. But, and this is crucial, low counts or even zero oocysts found in a sick animal does not rule it out. The damage might have happened before shedding started. Conversely, a perfectly healthy immune animal might be shedding some oocysts. So OPGs are maybe more useful for monitoring the overall infection pressure in a herd or flock rather than diagnosing that one sick individual sometimes.
That makes sense. It's about the whole picture, not just one number. So given that the damage happens early, before signs, treatment seems like it might be too late sometimes.
Often, yes. Therapeutic intervention, treating with drugs once they're sick, is frequently less effective than preventing it in the first place. When an animal is clinically ill, treatment goals shift more towards supporting recovery, stopping further parasite multiplication, and limiting spread in the environment.
Okay, so what drugs are available when needed? What are the main types?
Broadly, the anticoccidial drugs fall into two main camps. You've got coccidiostats and coccidiocidals. Coccidiostats think static or stop. They arrest the parasite's development, slow it down, mainly acting on early stages. They don't necessarily kill the parasite outright. If you stop the drug, the parasite might resume its life cycle. These are often used for prevention, allowing that low-level exposure for immunity we talked about.
Okay, like putting the brakes on, and the other type.
Coccidiocidals, think homicidal. These actively kill or irreversibly damage the parasite during its development. They usually work on more stages of the life cycle, and stopping the drug typically doesn't lead to a relapse. They're more definitive killers.
Brakes versus killers, got it. Are there specific drug names or classes we should know? Any big warnings?
Sure, sulfonamides are a common class used in many species. Amprolium is interesting. It works by mimicking thiamine, vitamin B1, and blocking the parasite's use of it. But you have to be careful, especially in ruminants, because it can actually cause thiamine deficiency in the host.
Ah, okay, a potential side effect there.
Then there are ionophores. Monensin, lacilocid, very effective, widely used in poultry and cattle feed for prevention. But here is the absolutely critical, non-negotiable warning. Ionophores are extremely toxic to horses. Fatalities can occur. Never, ever let horses get access to feed containing ionophores.
Wow, okay, that is a huge one to remember. Lifesaver for some, deadly for others.
Exactly. And then you have the triazemes, like toltrazuril and diclazuril. These are really potent, broad-spectrum coccidiocidals. That single dose of toltrazuril in baby piglets, that's a triazine. Very effective prevention strategy.
Okay, so drugs are part of it. But if an animal is sick, what about just basic care?
Oh, supportive care is absolutely crucial. Cannot be stressed enough. When you see clinical signs, damage is already done. So number one is hydration and electrolytes. Fluid therapy if needed. Nutritional support if they're not eating. Keep them warm, dry, clean, low-stress environment. Separate them if possible. And sometimes antibiotics are needed, not for the coccidia itself, but for secondary bacterial infections that can jump in when the gut is damaged.
Right. So if treatment is often playing catch-up, the real focus has to be prevention, right? What does effective proactive management look like?
Exactly. Prevention is king. Modern management is all about integrated prevention and control. And the first line of defense, environmental management and biosecurity. Simple stuff, but critical, like removing manure regularly. Remember, those oocysts need a day or two outside to become infectious, so quick cleanup helps break the cycle. Keeping things clean and, really importantly, dry. Moisture is essential for sporulation, good drainage, fixing leaks, designing feeders and water so animals can't easily poop in them.
Makes sense. Basic hygiene. What about disinfection? Can you just spray something and kill these oocysts?
Ah, that's a huge challenge. These oocysts are incredibly tough. Most common disinfectants, they just laugh at them. You need specific things, often harsh chemicals like ammonia or cresol compounds, which usually can only be used in empty barns because they're toxic. Steam cleaning, intense heat, or long periods of dryness and direct sunlight can also work, but it's not easy.
So not your average cleaner?
Not at all. And alongside cleaning, managing stocking density, avoiding overcrowding, and reducing stress factors, like during weaning or transport, those are fundamental preventative measures.
Okay, so environment is huge. What about using those drugs preventatively? You mentioned that,
Yeah.
especially in big operations.
Right, that's strategic chemoprophylaxis. Using anti-coccidial drugs in the feed or water continuously or during high-risk periods.
Hmm.
Very common in poultry and feedlot cattle. But the massive elephant in the room here is drug resistance. The parasites evolve, the drugs stop working as well. It's a constant battle.
So how do producers fight resistance?
They use specific strategies, like rotational programs, switching between different classes of drugs every few production cycles, or shuttle programs, using one drug early in the animal's life, then switching to a different class later in the same production cycle, trying to keep the parasites off balance.
Rotating drugs, shuttling drugs. It's like a strategic arms race. Is vaccination an option? Can you just immunize against it?
Yes, vaccination is a really important tool, becoming more common, especially in poultry, as a sustainable alternative to relying solely on drugs. The main type is a live vaccine. You give the birds a controlled low dose of live sporulated oocysts of the important Eimeria species. It causes a very mild subclinical infection, enough to stimulate strong natural immunity.
So you deliberately give them a tiny bit of the disease.
Essentially, yes. And for it to work best, the environment plays a role. The vaccinated birds shed the vaccine oocysts, they sporulate in the litter, and then the birds pick them up again. This recycling boosts the immune response across the flock.
Interesting. So the litter management is part of the vaccination strategy.
Absolutely. There's also research into subunit vaccines using just parts of the parasite to trigger immunity without using live organisms. That's more cutting edge. And don't forget good nutrition, vitamins A, E, K, minerals like selenium, zinc, and smart husbandry, like all in all out systems where you empty and clean barns completely between batches or keeping different age groups separate. It all adds up.
Okay, this next point feels really crucial, especially for anyone listening who has pets or works near livestock. Let's get this distinction crystal clear for everyone's safety.
Yes, absolutely vital. This is the key public health takeaway. The parasites we've mostly been talking about, Eimeria and Cystoisospora, the ones causing the majority of coccidiosis in farm animals and pets, they are highly host-specific. Let me repeat that. They are not considered zoonotic. They don't infect or cause disease in humans.
Okay, so just to be absolutely sure, if my dog or cat gets diagnosed with Coccidiosis cystoisospora, I don't need to worry about catching it myself.
Correct. Your cat's Cystoisospora is not going to make you sick. However, and this is where the confusion can happen and why precision is critical.
Yeah.
We must distinguish coccidiosis from cryptosporidiosis. That's caused by a different parasite, Cryptosporidium. And Cryptosporidium parvum, often found in young calves, is a major zoonotic pathogen.
Ah, okay, crypto. That's the one we hear about in waterborne outbreaks sometimes.
Exactly. It's a huge cause of diarrheal illness in humans, often spread through contaminated water or direct contact with infected animals, especially calves. And it's a particularly serious risk for people with weakened immune systems. It can be life-threatening for them.
Wow, okay. Huge EE difference. Eimeria cystoisospora equals animal-specific. Cryptosporidium, zoonotic risk, especially from calves. So for crypto, what's the practical advice? How do people protect themselves?
Transmission is fecal oral, contaminated water, food, touching infected animals or surfaces, and then your mouth. So the absolute key is good hygiene. Thorough hand washing with soap and water after handling animals, especially calves, or working in their environment, or before eating. And here's another critical point. Alcohol-based hand sanitizers. They are not effective against Cryptosporidium oocysts. You need soap and running water to physically wash them away.
Soap and water, not just sanitizer. Got it. That's really important information.
It really is. And it highlights why vets and doctors need to be super clear when they talk about these parasites. Saying coccidiosis when you mean crypto or vice versa can cause real problems.
Okay, well, that brings us towards the end of this deep dive. We've gone from this tiny parasite to, well, a massive global issue impacting animal health, welfare, and economics. And it's fascinating how understanding that really intricate life cycle, that pre-patent damage, that host-parasite balance, It completely shifted the focus from just treating sickness to really strategic, proactive prevention.
Absolutely. And the challenges continue, Drug resistance is a huge one. So the future is really about integrating everything we've talked about. Better environmental control, smarter drug use, definitely new vaccine technologies, maybe those subunit vaccines, maybe even looking at natural compounds in feed. It's got to be a multi-pronged approach.
Yeah, definitely. So as you, our listener, go about your day, here's something to maybe chew on. Think about the delicate balance we discussed, allowing just enough exposure to something challenging, like this parasite, to build resilience and immunity, but preventing an overwhelming infection that causes real harm. That's not just a concept for managing coccidiosis, is it? You see parallels in other biological systems, maybe even in how we handle challenges in society or our own lives. Where else might that kind of integrated, preventative, balancing approach be really useful? Something to think about.